Or the smell of liquor, he would immediately, vomit. After that, he's fine. But I thought that this is bad. I mean, I have no problem. Because whether it is liquor or whether it is bad gases coming into your system, you're not responding. But much later, I realized that probably those Vaidyas were actually more healthy. Because their dhatus were not willing to accept, these toxins. And that at the slightest hint of a toxin, the body was trying to reject it. But many of our systems are happy, accommodating it. And we think for the time being that we are actually healthy. But what is happening is we are allowing these toxins to deposit and accumulate. And our dhatu does not have the ability to reject them. So when I mean immunomodulation in Ayurveda, it is actually strengthening the dhatu and the ojas. And what you will find, maybe you have become a little more sensitive. But then if you want to, you have increased the body's intelligence. Body has an intelligence to know what is good for it and what is bad for it. You don't even have to think about it. When you see something, that is how Ayurveda discovered the properties of many of the plants. That is why we say the rishis discovered it. Because when they saw a plant, they had a sense. Many animals know this. This is called a zoopharmacognosy. They don't think. They can know what is good for them. Our body has this ability. In fact, Panchakarma and all these measures would be helpful. Otherwise, I can think of a funny situation where we do Panchakarma and become very healthy. And then we'll all start sneezing and, purging when we move around in these, polluted cities. So it's also designed in such a way that we change our environment also. It's a complete holistic kind of movement. So I just wanted to point that there are methods in Ayurveda where we can eliminate these toxins and we can strengthen our dhatus that we will not allow our system to harbor these mechanisms. Plus there are growth inhibitors. These are medicines which actually balance. Many of them are rasayanas also, which bring balance in the overall growth of the dhatus. No one dhatu will be able to grow, disproportionate to the other. And that is why many of the rasayana dravyas have been found to be effective in the management of cancer. Because they re-establish the metabolic pathways, which bring balance into the transformation of the dhatus. So that is what I mean by, I use the term growth inhibitors, but they are actually, rasayanas of the kind which will bring back balance to the. And then of course diet regulation, exercise, and even psychotherapy, which helps you to keep your mind, stable, yourself as one whole. All these are very powerful methods in which we can prevent cancer. And I think India was a good example until recently of a society which practiced many of these principles, and which is why statistically we found, many scientists have found, that the incidence of cancer was much less. But the situation is changing today, and the incidence of cancers are also increasing. Now we have, surgery is definitely considered as an option in Ayurveda. So this is what I want to say is in our own experience, see, when we get a cancer patient, it is very difficult to decide whether to treat him or not. We hardly get a patient who immediately after diagnosis of cancer, or a situation where we primarily diagnose cancer, this is very rare in an Ayurvedic clinic. Except in few centers where they have already announced that we are treating cancer, such centers are very few in India. But in most other places, they are already started treatment, or their treatment have failed. Majority of the cases that come to our hospital, I'll show you statistics, are cases after a few cycles of chemotherapy, post-surgery, and we hardly get them in the beginning. 5 minutes? Okay. So, yes. So maybe then I must talk a few clinical experiences and conclude. So just a few, I think hardly a year ago, a French oncologist came to our hospital saying that we would like to do a movie on what is Ayurveda. I want to introduce Ayurveda. He's a very renowned oncologist. And I'm sorry, I cannot remember these French names, but if somebody is interested, I can, get the details. He's a very well-known oncologist in France. And so we asked him, what makes you interested? So he said one of his patients came to, she had breast cancer, and he had written her off. And he was surprised to see her 1 year later, healthy and happy and with no signs of the cancer. And she said that she went to Kerala and had an Ayurvedic treatment. So he was completely dumbfounded. He said, I want to explore what is possible in Ayurveda. So I would like to come and see what type of treatments you're doing, and also explain to the French public that there is something called Ayurveda which is an option. So this was one instance of anecdotes. Such anecdotes abound. We have in our hospital, even now, a very great businessman from the Gulf who was written off. Many of his organs were cut into pieces and he underwent a lot of cycles of chemotherapy, and the doctor said he will not survive. But it's 8 years now since he's living, with half-cut organs, but still living. And he comes every year to our hospital to undergo, another cycle of these therapies, the detoxification, immunomodulation and all that, and he's able to survive. We have found in many cases, but there are also cases where we have had failures, because many of them come when they are almost dead. But one area where we have found very great benefit that we can give is to help the patients through the process of chemotherapy and radiation. We have had amazing results where, so now if you ask, we never make claims. We never ask any fresh cancer patient to come to a hospital because we don't want to get into legal difficulties. But for patients who are undergoing chemotherapy, when they take some of our rasayanas together, even radiation, they are able to go through it without or minimal or almost no side effects. Because we have seen that happening. Patients who have had, so many of them come with inflamed, mucosa of the entire alimentary tract. Many of them lose hair, they become, very thin, and they go through tremendous pain and, difficulty during that period. When they also take our medicines together, during chemotherapy and radiation, giving support from Ayurveda is definitely, very, very successful. Another area where it is very clear is that even end-of-life management of cancer, we are able to improve the quality of life. It is sometimes amazing. Patients who are on very strong painkillers are able to stop that. They eat food, they die eventually, but at least, in their last days, they are able to wean off all these strong medications and eat food. And sometimes we even hope that maybe they will live, but they don't. But still, their quality of end-of-life quality improvements are very much possible. Now, okay, I just quickly go through a few slides. These concepts I mentioned, and I will conclude in 2 minutes. So you can see tumors are also very different. All tumors don't follow the same course. So, our prognosis for different types of cancers are also different. Some of the diseases where, again, there is no time, I wanted to show the kind of cases that came to our hospital, so that you will have, these are all, medicines that can be used, which are commonly used formulations and things like that. But here's a data about 145 cancer cases. Yeah, this is the last slide I wanted to show. These are the kinds of cancers that we have commonly encountered in our clinic. So our clinical observations are based on these patients who have come in various stages of the disease. And if you ask me what Ayurveda can offer to cancer, I think it is in the prevention area that we have tremendous potential. And if you look at it even from a practical point of view, because of all limitations, Ayurvedic physicians are unable to do many experiments with full-fledged cancer patients. We have so we have found good results in liver cancer also, which leads to comatose stage patients, and breast cancers, stomach cancer. There are patients who have, visited our clinic with cancer of the stomach, and so this is just overview of the type of cancer patients that we have treated. So to conclude, I would like to point out that Ayurveda had understood what the disease cancer is, and it gives certain realistic assessments that cancer, more than looking for a cure for cancer, which should be continued, Ayurveda says that it's much more easier to prevent cancer. And that if we adopt very simple, regimens into our daily lifestyle, then cancer can become definitely an unheard of disease. The body is not really designed to develop cancer. And one key thing is that Ayurveda puts cancer under the condition called shobha. Shobha means inflammation. So one simple thing that Ayurveda had recognized so many centuries ago is that cancer is an outcome of chronic inflammation. Like any inflammatory condition, if you allow it to persist in your body over a long period of time, that shobha can get converted into cancer. So I think I will stop here, and thank you very much for your attention. Is there time for a question or
one question, regarding European herbal medicine and Chinese medicine, oncologists are very afraid that there are interactions among the herbs and the oncology, the chemotherapy agent, and that the reason why the patients feel better is not because the herb works, but the herb does reduce the activity
of the, yes.
So,
Yes, we, yes.
Sharp discussion. How do you feel about
Yes, we are also not very, there are many diseases like in rheumatoid arthritis we have found definitely combining Ayurveda with methotrexate can create problems, because we found that happening clinically, and also in clinical trials we found that information. But in cancer, we have found in all these, like I had a few case studies where along with chemotherapy, when they used our medications, actually when the tumor markers became completely normal. So whether it was chemotherapy that worked or our medicine which worked, we do not know. But the patient, the cancer had actually resolved. So we are also looking at those outcomes, because patients won't come to us if their cancer is getting worse, but they are feeling better. So I had about 5 cases which I wanted to show where, along with chemotherapy we had taken, and one patient, actually he had cancer of the esophagus, which is said to have a very virulent course. Of course he died, but we were able to prolong. So after his first cycle of chemotherapy, he was not responding well. And then during the second cycle, he came to us for treatment. And while he took our treatment and chemotherapy, he had remarkable improvement. And the doctors also were surprised that, it went into remission, the tumor markers became normal. But 1 year later, he had another, recurrence, and this time he passed away. So we have observed it actually. But the thing is, even this difference was considered very significant, because the chemotherapy did work. In fact, it is only in cancers that we have found that when we give supportive treatment, the outcomes are really good. But I agree with you that there is this possibility. This should be the subject of future research. So I didn't come to those slides where I said which are the, one big thing is we have found so many herbs which are potentially, anti-tumor, working at different mechanisms. They are either working at the tumor mediating, mechanisms and inflammation, but none of them have actually we've been able to translate into a potent medicine for cancer. Similarly, these issues, like one of the major issues for research is how do we integrate Ayurveda with modern care for cancer, because it's almost impossible for Ayurvedic physician to manage cancer independently. And when we look at that, these kind of questions and issues come. And I'm sure no oncologist would be satisfied with our answers unless we really show to him, how this can work together. Yeah.
But there's a point, because it is not only in cancer. We have enough of experience in resistant tuberculosis patients that if you add, tissue responses are definitely positive, and we have had thousands of the cases. I was treating tuberculosis only when resistant patients were coming, because since specific treatment is available, whenever a patient approached me, I insisted that you go for first line treatment. It is criminal not to have it. And though I am an Ayurvedic physician, I don't give, and I have had enough of experience. Statistical publications are there, so it is quite possible.
Tuberculosis and also epilepsy. See, many modern epileptic drugs, there is Vitex negando is one herb, which has been definitely shown to minimize the dosage requirement for drugs like Eptoin. Like if you also take Vitex negando, then this is very useful. But this is again, no translation has happened. I mean, these are isolated studies which showed that because Eptoin at higher doses can cause severe, side effects. So similarly, as Mishraji rightly mentioned, the bioavailability of many of the anti-tubercular drugs are enhanced by piperine, which is found in Piper longum. Like if you add piperine along with, so it's very much possible that we can have piperine fortified, anti-tubercular drugs, which can work at much lower dosage. And so these are the areas where we need to have collaborative research, but which appear very promising. And I believe that we have to integrate modern and Ayurvedic methods, because as you can see, many of the principles of Ayurvedic management of cancer have not changed over the years, and modern medicine has improved methods of surgery. So if we have an integrative approach to oncology, we can have, and this we found are different for different types of cancers. So if we can have a